Hello, Your Worship and Councillors. My name is Daniel Fuller. I live in Riversdale, and I'm a professor at the University of Saskatchewan in the Department of Community Health and Epidemiology. I have been studying road safety and specifically bicycle safety in Saskatoon and other Canadian cities for the past 10 years. The Avenue C cycling corridor, which we just debated at length, and the 30-kilometre-hour bikeway decision at Council, I think are linked. And these are all consistent with the community guide as community plan as Councillor Dubois mentioned. I think it's really important that we realize that cycling infrastructure, it's clear that cycling infrastructure makes roads safer for all road users, and that a decision of creating a 30-kilometre-hour speed limit has important decisions that particularly affect motor vehicle drivers. So because I'm a data person and this is what I like to do, I collected data from the Saskatchewan Traffic Analysis System, which is a reporting system required by the province and SGI. Along the Avenue C bikeway corridor, there's approximately 550 collisions per year over the past 10 years on average. That's 1.5 collisions per day along Avenue C. And studies have shown that, studies in Toronto, for example, have shown that there's a 28% reduction in crashes from all modes and a 67% reduction in crashes involving ambulances if 30-kilometre speed limits are implemented compared to 40-kilometre-hour speed limits. Applied to Avenue C, this would mean that we would go from 550 crashes per year to 396 crashes per year for all road users, cyclists, and motor vehicles equally. We also know that cycling infrastructure, so that's the first part. Second part, the World Health Organization recommends 30-kilometre-hour speed limits in urban areas as a key policy that can help save lives. Saskatoon has a precedent for implementing good policy related to speed limits. In preparing for this presentation, I worked with colleagues at the Saskatchewan Health Authority to get data on the number of emergency department visits due to road traffic collisions in 2021-22 and 2022-23 fiscal years. These data have not yet been publicly released. In 2021-2022 fiscal year, there were 1,084 road traffic crashes emergency department visits due to road traffic crashes. And in 2022-2023, there were 1,068 emergency department visits due to road traffic crashes. Among people riding bicycles in the city, there were 415 and 358 emergency department visits in the respective fiscal years, and for drivers, 527 and 457 emergency department visits in 2021 and 2022 fiscal years, respectively. To summarize these data, in Saskatoon, there are near 3 emergency department visits per day caused by road traffic crashes. Approving 30-kilometre speed limits along cycling corridors is a critical policy that can improve road safety and reduce the major burden of road traffic crashes and emergency department visits in our city. I think these are data that we haven't really been able to discuss, and often this is one of the challenges I think with municipal policy is, it's hard for the city to get data on emergency department visits and these other major consequences of roads, which the city is responsible for, but the city is not necessarily responsible for health. So finally, I want to reiterate that while these policies may be focused on people riding bikes, policies will have a significant impact on road safety and benefit all road users. This isn't really about cyclists versus motorists. These policies are about creating opportunities for people to choose the types of transportation they want to use without compromising their safety or the safety of others. These policies are about the vision we want to create for our city. Thank you very much.